Carcinogen, nitrosamines. Source: found in smoked foods, preserved meats, and some pickled items. Especially common in traditional diets from East Asia. Mechanism: nitrosamines are activated in the stomach and cause DNA damage in gastric mucosa. Organ affected: stomach. Cancer caused: gastric cancer, specifically the intestinal type. USMLE Question 1. A 67-year-old man from Japan presents with weight loss, early satiety, and epigastric pain. Upper endoscopy reveals an ulcerated mass in the lesser curvature of the stomach. Biopsy confirms intestinal type gastric adenocarcinoma. Which dietary factor most likely contributed to his condition? A. High-fat diet. B. Consumption of aflatoxin-contaminated grains. C. Smoked and preserved foods high in nitrosamines. D. Excessive alcohol and caffeine intake. E. Raw fish containing liver flukes. Correct answer: C. Smoked and preserved foods high in nitrosamines. Nitrosamines from smoked or preserved foods are a strong risk factor for intestinal-type gastric cancer. Why not the others? Incorrect. High-fat diets are linked to colon or pancreatic cancers, not stomach. B. Incorrect. Aflatoxins cause liver cancer, not stomach. D. Incorrect. Alcohol is linked to esophageal and liver cancer, not directly to intestinal-type gastric cancer. E. Incorrect. Liver flukes are linked to cholangiocarcinoma, not gastric cancer. USMLE Question 2. Which of the following best explains the role of nitrosamines in gastric carcinogenesis? A. Inhibits p53 and prevents apoptosis. B. Activates estrogen receptors in gastric mucosa. C. Causes DNA alkylation and mutations in epithelial cells. D. Promotes gastrin release leading to hyperplasia. E. Triggers autoimmune gastritis and atrophy. Correct answer: C. Causes DNA alkylation and mutations in epithelial cells. Nitrosamines are metabolized in the stomach and cause DNA damage, especially in the gastric epithelium, leading to adenocarcinoma. Why not the others? Incorrect. p53 suppression occurs in many cancers, but nitrosamines directly cause DNA mutations. Being correct. Estrogen receptors are unrelated to gastric cancer. D. Incorrect. Gastrin hypersecretion is more related to Zollinger-Ellison syndrome. Incorrect. Autoimmune gastritis leads to pernicious anemia, not directly to nitrosamine-induced cancer.